Gauteng province, where a healthcare crisis is currently underway. More than 34,000 patients, we understand, are waiting for surgery across the province's public hospitals. Some have been waiting for years, and it ranges from cataract removals to orthopaedic procedures. Let's talk now to the Acting Chief Operating Officer at the Gauteng Health Department, Dr. Percy Mkhulu Selepe. Dr. Selepe, good morning to you, and thank you very much for your time. These numbers came out following that written response from the Gauteng Health MEC after questions were posed by the DA's Jack Bloom. So 34,000 patients, we understand, waiting for surgery across the province's hospitals. As I mentioned in the introduction, some waiting for over 2 years. How do you explain the backlog?
Yeah, good morning, Iman, and your your viewers at home. Yes, it is true that we have, as the Gauteng Department of Health and Wellness, released those numbers as the patients who are waiting for various categories of surgeries within our hospitals that are designated to perform those particular surgeries. Yes, we as a department acknowledged that some of them have been waiting for longer than the expected treatment time guarantees that are supposed to be there, especially patients that require long surgeries, like you have highlighted in your opening statement, like orthopedics, where we talk of hip replacement and knee replacement. But most of the patients that comprise that 34,000 that we've released are patients that are waiting still within the treatment time guarantees that are determined per category of the procedure that we do. Yes, we have numbers that are waiting as well for cataracts within the province. But also, Iman, what is key to this information is that as the department, we acknowledge, and there is work as well that we are doing to try to resolve these issues, because they also worry us and also our doctors that are on a daily basis having to manage and engage with these patients at different levels and different times.
All right, we'll come back to that plan in a little more detail and specificity. You mentioned cataract surgery. So cataract removal, we understand, Dr. Selepe, tops the list. There are more than 9,000 people, many who are elderly, who are left to live with preventable blindness. What's your message to them, given that, you know, it is tantamount to a gross violation of their constitutional right to adequate health care?
Yes, we have patients that are waiting for those operations like cataracts. And on our side as a department, we are trying to work in terms of ensuring that we treat each and every of those patients within the time that we've guaranteed, which for some of the cataracts, it will be around 40 days, between 40 days and 60 days. And what we are doing also, we are engaging with partners that we work with, and we are also trying to provide extra theaters available on Saturdays that we are able to do these cataract surgeries. But unfortunately, as a department, we are inundated with a lot of these patients, not only coming from the Gauteng. If today you can visit one of our busiest centers in terms of cataract, which is Chris Hani Baragwanath St. John's Hospital, we receive between 500 and 700 patients on a daily basis. You would find buses and taxis and cars coming outside the province, because as a province, there is at least something that we are trying to provide for these patients. But somehow, we are also limited by the resources that we have, the theater nurses, But with our partners that we're partnering with them on dealing with these issues, we are trying to say, let's open up Saturdays, let's open up more centers that can deal with these patients, because we are also expanding with these partners to try to involve the district hospitals, which initially were not providing this service. But due to the demand, we see that we also need to take this to those services, like Bheki Mlangeni Hospital, which is in Soweto. With the help of Chrisani Baragwana, Bheki Mlangeni is now able to provide the cataract service. Lenasia South, which is one of our CHCs on the south, due to the help of Chrisani Baragwana as well, we are providing some of these services there. But we also want to increase the number of days.
I want to come in very quickly because I've got to go to a breaking news item, but I want to ask you this question. It doesn't seem as if, I mean, it sounds like an overwhelming situation. As you say, 500 to 700 patients arriving daily, not all of them from the province. Are you going to limit people from coming from outside the province to do that? But also, you have the backlog that you have has already increased in a period of 8 months by 10,000 people. It sounds like the situation is completely out of control. Would you agree with that?
Well, it's not exactly out of control, because if you look at the numbers that we've just operated after we've released those numbers between January and May, we have operated above more than 25,000 elective cases so far in the department between January and now. So there is work that we are doing, but unfortunately, we are inundated with a lot of patients that realize that the Gauteng at least is able to do something to help, and they come here. We receive this request on a daily basis, where people, those who probably, for instance, would be knowing Dr. Selepe, would be requesting, can I bring my relative who is probably in the Northwest to get this service? But unfortunately, as the department, we cannot deny people access to healthcare. If people come requesting for service, we are obliged and we have to provide that healthcare to those who need it. We do not segregate based on where you come from, because that person needs service from us. We provide the service.
This is an important story, I think, Dr. Selepe, which we must give more time to, especially for all of those patients who are looking at officials in the health department here in Gauteng for certainty about when those operations can be completed. Thank you for your time this morning. We appreciate it, Dr. Percy Selepe, the acting COO at the Gauteng Department of Health.